Dear students, today I shall be discussing about the clinical features of allergic rhinitis. Traditionally, allergic rhinitis was classified into seasonal allergic rhinitis, perennial allergic rhinitis, and occupational rhinitis. But new classification classifies allergic rhinitis into mild, moderate to severe symptoms and intermittent to persistent symptoms. So, following the old classification, the symptoms of allergic rhinitis differ in different type of rhinitis. Seasonal is equal to intermittent symptoms, and perennial rhinitis is equivalent to persistent symptoms. Most common symptom of seasonal allergic rhinitis is sneezing. Sneezing happens in paroxysms, around 5 to 7 episodes in one attack, or up to 10-20 episodes per attack. It might occur in frequent episodes throughout the day, maybe in the morning, in the afternoon, or in the evening time, but more in the morning times because the pollens drop down in the morning time. Therefore, the patient may have more sneezing while waking up from the bed or in the early morning time. Nasal discharge may be watery, mucoid, or yellowish. Yellowish discharge is rare in case of allergic rhinitis, but may happen when there is increased eosinophilic load in the nasal mucosa. Therefore, when there is much mucus, the discharge may be yellowish also. The patient may also have nasal obstruction and blockage of nose, more commonly when there is sneezing and itching of nose. There shall be itching of nose, eyes, and palate. The patient may have tearing or redness of the eyes and may have periorbital edema also. All are suggestive of allergic condition. There may be burning or raw sensation of the throat because of mouth breathing or because of allergic pharyngitis. The patient may have wheezing or chest tightness due to allergic asthma. As we should know, around 40% of patients having allergic rhinitis may develop allergic asthma in their lifetime. This is all about the features of seasonal allergic rhinitis or intermittent symptoms. What are the symptoms of perennial or the persistent symptoms? They are long-standing nasal congestion and PND. PND stands for postnasal drip. Sneezing, itching are less common in case of persistent symptoms. The discharge may be viscous or purulent watery rhinorrhea. Conjunctivitis is less frequent. Secondary symptoms like loss of smell and taste, sinusitis, and stage tube dysfunction may be there because of edema of the nasal mucosa, more on the posterior aspect. As already told, sneezing is less common in comparison to the seasonal condition. In case of seasonal allergy or in acute attacks, sneezing, itching, and watery discharge is more common in comparison to persistent symptoms. What are the signs? Common signs found in nose are transverse crease at the dorsum of the nose, also called as Darrier's line. You can see Darrier's line here, which is due to persistent nasal rubbing, that is so-called salute, nasal salute sign. This is the allergic salute. The patient rubs the nose upwards, that leads to positive allergic salute, that leads to Darrier's line between the bony and the cartilaginous external nose. The patient may have watery nasal discharge, and the nasal mucosa may be pale or bluish on inspection, as you can see here. The terminates may be buggy and swollen or hypertrophied. This is the hypertrophied terminate. The nasal mucosa is pale and bluish over here. There may be polyps in case of allergic rhinitis, and septal deviation may also be present. There are certain signs found in the eyes. They are periorbital edema, conjunctival congestion, and watering from the eyes. There will be marked erythema of the palpebral conjunctiva and papillary hypertrophy of the tarsal conjunctiva, so-called cobblestone appearance. The patient may have dark circles under the eyes. They are also called as allergic sinners. You can see here, these are the dark circles under the eyes, and they are due to repetitive vigorous rubbing of the periorbital region and impaired venous return from the skin and subcutaneous tissues. It is supposed that allergic signals do not subside with use of medications for allergic rhinitis. There may be presence of extra skin fold or line under the lower eyelids because of edema. This is called as Denny-Morgan lines. We should know that the lower eyelids are the very thin skin structures which are commonly shown in case of allergic rhinitis. The child may have retracted tympanic membrane and otitis media diffusion also because of station tube block. In the pharynx, there might be granular pharyngitis or cavulation appearance. This is the cavulation appearance. You can see here our granular pharyngitis, and patient occasionally may have laryngeal edema and bronchospasm, and the patient may have allergic asthma also. I think I am clear regarding the clinical features of allergic rhinitis. Thank you very much.